Um, so the first question that I have for you is, what was the complexities that you were concerned about? Okay, so if you can answer that, what were the complexities that you were concerned about pre-surgery?
Okay, so leading up to the surgery, the complexities that we mostly concerned about, firstly, it's the safety of the kid in terms of anesthesia, as these are newly born babies, so there's lots of planning and expertise that are needed for such small babies, and then also from the neurosurgery team, like I said, we still had unknowns whether the brains were connected or not, even though we've done imaging. And then also from our side, from plastic surgery, we were concerned about bleeding. The scalp is very robust in terms of blood supply, and these babies can bleed, a lot during such a big operation. So I would say those were the main three concerns that we had to plan and, very carefully.
Okay, and then so following the surgery, so everything went according to plan? And how do you feel after the surgery?
Yes, everything went to plan. Like I said, it took a lot of detailed planning, and we had to plan very carefully our scalp flap for adequate soft tissue cover. So we were able to cover both the baby's scalps with their own tissue. So in terms of soft tissue cover, they won't need any further operations at the moment. So that went very well. And post-surgery, yes, I feel very happy. I feel very happy for the mother, and this is just highlights that in our country we do have resources for such operations to take place, and I'm happy for the family, for the mother.
You can go. You can continue.
Yes.
So you're finished. Okay.
So I'm very happy for the mother, and like I said, they travel from far, all the way from Eastern Cape. This is almost a miracle that the baby survived to get to Red Cross from Eastern Cape.
All right. So thank you, doctor. And then final question is, what is the follow-up, the aftercare, and potential future surgeries that these twins might require from a plastics perspective?
At this phase, we are concerned about them developing infection, so we've taken every precaution to prevent that from happening. So if they develop an infection and get wound sepsis, then they will have to go for further operations. And then in future, we need to monitor them. We are a center of excellence, and we do have our combined specialist clinics where the babies will be seen, and these involve neurosurgeons, plastic surgeons, and maxillofacial surgeons. So the twins will have to be monitored from all perspectives, from the specialties I've mentioned, and also if they develop, they need to be monitored if they develop complications like craniosynostosis and hydrocephalus, and then that will have to be managed. And then, but from the plastics perspective, we will monitor them, and then we will do further operations if needed in terms of reconstruction. For example, if they do develop craniosynostosis, they will have to go for a skull reconstruction. So those are bigger operations. So yes, the baby will be monitored closely.
Okay, so sorry, I know I said it was the last question. Just to follow up, so the skulls where they were joined, it was soft tissue, so there wasn't any bone fragment.
There was a bit of bone.
Was there a little bit of bone?
Yeah,
okay, so do we expect those pieces of bone to fuse together, or will they require some kind of closure, hard cover closure in the future?
Well, the bone that was attached between the twins, we expect that to grow because they're still very small. So we expect that they will heal nicely, and then the bones will regenerate and heal. And then, like I said, we need to monitor though for premature closure of the fontanelles. And if that happens, it might create more complications like hydrocephalus and raised intracranial pressure. So the neurosurgeons will monitor them from that perspective, and then should further operations be required, we will do so.
Perfect.